to develop a link between patients and the practice team and to improve services. We recruited members opportunistically. We actually approached the Scottish Health Council, who helped us to go around to the community members. We actually publicised in our waiting room, and we publicised in our patient information leaflet, and we had notices around the practice, inviting volunteers to the group.
I received a letter from Diana Hamilton, the practice manager, and she had been in touch with Fife Council, and they had recommended me as I'm chairman of Dalgety Bay Folk Club.
A bit intimidating at first because it was part of it. You feel, oh, well, the patient's behind the scenes, what's going to happen here? But actually, it's been a really positive experience. Been very helpful. People involved in the group have been very understanding of some of the pressures that we face. And I think it helps us to understand their perspective as well, because we do get some feedback from the group of both a positive and a negative nature.
Well, I'm a retired GP and now experiencing the health service from the other side of the fence. I wondered whether I might be able to offer some comments from both points of view and an understanding from the GPs and the practice side in addition to the patient side.
Brightened up the surgeries by making contact with all the local schools in the area, and they've been contributing paintings and drawings, so we've been putting them up around the practices, and that's really got a lot of good feedback from staff as well as patients. We've been in contact with the local free newspapers that just get put through the doors, and we've got our own articles now, so we're raising awareness of the patient group within the Inverkeithing medical group. The other things that we've been doing is when they have training days, half-day training days, they've asked the PPG to come in, and we work with the doctors and the nurses and the reception staff in the workshops and putting a patient point of view across. And we're not trying to come in and complain. I think that's what the GPs were worried about, that we were only come in with complaints and concerns and medical issues, and in our group has not been like that at all. We've been very, very positive, and we come in and just contribute to in the training days, and a lot of our ideas have been taken on board.
It's nice to have a patient's idea of how the service is run, and for us also to demonstrate behind the scenes of what goes on that patients maybe don't get to see and don't understand goes on behind the scenes.
So it really is useful to get a feedback from a patient's perspective of what's important to them as regards access and how to improve that. I think really there are some good suggestions to try and help us shape the service to hopefully improve things. Also improving our uptake, well, hopefully we'll improve our uptake of flu vaccinations, things like that we think are really important, and additionally improving online registrations, and people will be using the website to order repeat medications, for example. These are things that make a big difference to our practice.